Hi, welcome to Maintain Me's resource channel. I'm Morgan. I'm the director at Maintain Me.
And I'm Chelsea, and I am the owner of Maintain Me.
Thanks, Chelsea. Today we are going to be talking about palliative care. Palliative care, and it is not hospice. So how is it different? And that's what we're going to cover today. So I'm going to start with the definition. I think that's a helpful place to start. So palliative care is a comfort-based program. So we are looking at helping people who have chronic diseases, not necessarily terminal diseases, but oftentimes, yes, find comfort, whether it be pain management, mitigating other treatment plans that may be causing discomfort versus focusing on the quality and the quantity, not the quantity, but the quality of the life.
And then Morgan, since we're on the topic of describing what that looks like, can you tell us a little bit about the team who is put in place for palliative care?
Yeah, great segue there. So it's interdisciplinary. That is the main focus of palliative care. So interdisciplinary would mean, in this case, probably a nurse practitioner or a doctor signing orders. It's going to be a social worker oftentimes, because they're going to help collaborate resources, find things that the family maybe needs to help this person while they're ill, extra support meals, that type of community resource. And then also it's going to be oftentimes somebody spiritual. So that can look many different ways depending upon the religion or spiritual preferences of the person, but usually a chaplain along with the rest of the team.
Awesome, thank you. Okay, so let's talk a little bit about some of the differences. So a lot of times when people are coming to us and they're saying, hey, I need help at home, that means so many things. We're going to start with the lowest, and that's home care. We're not going to talk about any of these today, but we're going to kind of show you on a scale of where palliative kind of fits into some of these things. So palliative, the good thing about palliative care is that it can be paired with other home services that are covered by insurance. So home care is not covered by insurance. It's a private pay thing. However, that does not mean that they cannot also take advantage of palliative care. The next level up is going to be home health care. Again, we're not going into any of these today, but home health care, the goal is that it's going to be a skilled service where people are coming into the home, nurse, physical therapy, occupational therapy, speech therapy, social worker, and CNA. Or I should say, not always, all of them. And the goal of home health care is to return back to baseline after something happened. Then you go to the next level, palliative care. Again, palliative care can kind of be branched on top of those two things, but palliative care is what we're talking about today. But the biggest misconception is palliative care and hospice. So when I talk with clients about what is palliative care, one of the things, and I think the easiest way to kind of understand it, even though you can pair it with other home services, is that it's really a nice bridge between home health care and hospice. And this isn't every situation. However, let me give you an example. So home health care, you could be, say, mom or grandma or dad or whoever is in home health care and they have a goal to get them back up to, I don't know, walking with a walker or out of the wheelchair. And they do have a chronic illness. And week after week, they're not meeting their goals. They don't really, they're like, this is a lot of work. Do I want to be out of the wheelchair? I'm in a lot of pain. I'm doing things to take care of that pain. My goal is not to be walking again. This is a lot for me. Sometimes what a practitioner will recommend is, okay, well, maybe home healthcare isn't the best spot for you. Maybe we don't need to be pushing you to be, walking with a walker. Maybe we put palliative care in place. We have somebody that still needs to be kind of keeping an eye on you, helping you set some goals, having a little bit different conversations versus being aggressive with treatment and more about quality. And we start getting you connected in the right way. So it's really honoring that person and making sure that they have the support that they need when it might not be home health care. So say they're like, yeah, I'm done. I don't want to return back up to my baseline. I'm good where I am. This is my new baseline. I still need a little bit of support. Let's get, palliative care involved. You can have it at the same time. You can just transition into it. Maybe at this point, they're really focusing on quality like Morgan had talked about. Now, there's two different things that really focus on quality, and that is hospice and palliative care, which is why they're often mistaken for one another. palliative care, you could be chronic, but you don't have to have a terminal diagnosis, or you don't have to be terminal, which, it's kind of morbid to talk about, but like if you have 6 months or less, the doctor says you maybe have 6 months or less in your lifetime, this would be something that would be considered chronic. And Morgan's going to talk a little bit about some misconceptions about what that means here shortly, but that's kind of the big difference. So say palliative care, you're in palliative care, and all of a sudden, you do have a chronic disease and you've been given a new diagnosis that might be terminal. The palliative care person will then help you transition to, okay, you know what, let's take this the next scale up. You now get an increase of services because you meet those requirements, and we can transition you to hospice. You do not have to go from palliative care to hospice. It just could be a bridge to help you through the end of life. If you decide to stay on palliative care and you meet that requirement, you still need that, you can continue on that. You can graduate from palliative care and not go into hospice. So it is not this, if I go into palliative care, they're gonna push me over to hospice. That's not necessarily true. They just want to keep an eye and make sure that you're connected and you don't get lost in the mix and not get the support that you need through focusing on quality of life till end of life. So that's a lot of words, but that's kind of the difference between all the home services and how palliative care can play a role with those additional services that you get covered through insurance. So, okay, Morgan, I just talked a little bit about that terminal thing, and I kind of mentioned a little bit about how you're going to come in for some misconceptions. Can you tell us a little bit about what our clients talk about and some things that we have to educate on in regards to misconceptions with palliative care?
Yeah, palliative care, similar to home health, is not somebody who's going to come stay at your home and take care of you. It's a very common misconception that your visits are going to be hours long and they're going to be multiple times a week. And so this adds a layer of care. This adds a layer of medical care in that you'll have a nurse practitioner or a nurse come out and see you about once a month, and they'll probably be there about an hour. Then you'll have a social worker, again, probably about once a month, less often if stable, and they'll probably be there an hour. And then again with the chaplain. So all those interdisciplinary visits are about once a month, depending upon what you need, but they are not someone coming into the home to actually care for the individual with the illness. So another misconception is that palliative care is just for cancer. That's not true. Palliative care can be for anybody with a chronic or terminal illness. It's a insurance-based measure to focus on care and treatment and comfort. So that, like Chelsea explained, can be matched up with other different services. They are not interchangeable. Hospice and palliative care are not interchangeable. And let's see here. Was there another one? Sorry about that.
No, those are pretty much the big ones, I think. The other thing too, that I think is important to understand is going to be where palliative care can take place. Can you talk a little bit about like where palliative care happens and which kind of care settings?
Yeah, so it's very, very different if you're in a hospital and the palliative care comes to see your family or your loved one. That's they're in that setting, that's almost imminent passing. So that's very different. If you're getting palliative care and you're in your home or in your assisted living or your independent living or your nursing home, those are all places that palliative care can come. It comes to you, basically. So I'm not even going to dive into the piece about the hospital. Just know in a hospital setting, it is very different.
Yes. And then the other thing that my clients often talk about is sometimes the transition, if they do want to go hospice, maybe they know hospice is in their future. It's something that they want to take advantage of, but they're not ready for any of that. One thing that I have heard feedback on from clients is that it is nice to be able to transition within the same company. However, I've also heard from some clients that they feel a little bit of pressure because they have both sides. So definitely think about that and talk with somebody that, when you are interviewing palliative care companies, say, hey, Do you have a hospice side? Okay, great, you do. Is that only at home, or do you also have an inpatient setting? So hospice can transition. So palliative care, a lot of hospices do have that palliative care, so they can work together as a team and make that transition very smooth. But not all of them do. So understanding, and also, you know, talking with your family and trying to figure out, do I feel comfortable that they have that side? Do I feel that it's going to be pushing me into something that I don't want? Or do I feel really good about knowing that they have that in case I need it in the near future? So understanding what you feel comfortable, there's no right answer to that. There, you know, it's really just about choice and how you feel about the people. Maybe you're okay with changing later down the road if you need hospice. But a lot of people, sometimes they'll get close to their practitioners and things like that. Oh, that's another good question. Asking if their practitioners carry over, if they do have both sides, from the palliative care to hospice. So things to consider. Again, you know, people like ourselves are local experts. We can help set those things up and write these questions down. But those are some things that I would tell my clients when they're interviewing a palliative care, and there is no right answer, but understanding what you feel most comfortable with.
I think that is the right answer. You got to be comfortable with it, and feel free to change companies if you're not.
Absolutely. Absolutely.
Obligated.
One last thing, Morgan, is palliative care covered by insurance?
It is.
Awesome. So that's the other thing, is people are afraid to sign up for things because they're like, well, you know, I have to pay for this. So when you're asking, you know, does it, you know, if you're interviewing for a palliative care company, you're obviously going to ask them if they take your insurance. And then also, typically, if insurance does cover this, there are qualifying factors for that. So you would ask them, you know, be familiar with your benefits, be familiar with where you fit into that, and find out, okay, well, if I need this and this, do I qualify? When would I not qualify? When would my insurance no longer pay for this support? So just asking those things so that you could be prepared, so that something doesn't just cut off from you and then you're sitting there going, well, now what do I do? So just being educated and ask the right questions. Don't be afraid to ask any questions, any and all questions is what we say. So all questions are good questions if they're being asked. And so just be forward and honest and say, I just need to understand what my benefit is in this, and I want to know how long I can rely on this support and what that support looks like. So anything else that we missed, Morgan? Okay.
I don't think so.
So we are Maintain Me Senior Services. We do consulting, case management, home. We do transition services for free for clients here within Colorado. So if you're interested in any of those services, do yourself a favor and hit that subscribe button. We go through all the different things to educate you before even having to ask for help. We also educate through all of these things in the process of partnering with us through this journey in your life. So hit that. If you like this, hit the like button down below, comment down below if there's certain things you want us to cover. We do these videos for you guys, and we want to make sure that we are covering the content that you're most interested in. So thank you so much for joining us today, and we'll see you next time.
Signing off.
Bye.